Was there anything that you found in your research or in the process of writing this book on prenatal? Like if a mother is consuming vegetable oils, is there anything at play there where like it's affecting the health of the baby or anything like that? You just made me think of that as you were talking about, taking care of your children. Like even before you have your child and you're actually, in that prenatal phase, like is there negative effects there? I'm sure there is, but I'm curious if you found anything.
Yeah, as far as evidence for that, so theoretically, you would predict based on this first principles approach, you can make predictions. If something increases oxidative stress, it's going to increase the states of disease with pregnancy, with fetal development. It's going to reduce the ability, the capacity for health. So you would certainly predict that. So do you see any evidence of this? Well, yes, they have actually done animal studies because they can't do this sort of thing in humans, where they've fed, adult female mice food that's been adulterated with oxidized oil, like the kind of stuff that we would get when we eat chips, right? It's just that they stir the oxidized oil into the mouse chow instead of feeding mice chips. They just use the same kind of oil.
Mm,
And so that is, arguably that's the worst of the worst stuff. And so if anything, we're going to cause visible results, it would be that stuff. And do you see visible results? Yes. You see serious brain development disorders in when these female mice give birth. And that is whether or not they continue eating that same diet. It's worse if they continue. And it's regardless of what the mice eat, because the mice are, still weaning. So they're just doing the breast milk mostly, and they get normal chow. So you see like encephalomalacia, which is maldevelopment of the brain and all kinds of neurological problems where they can't walk, they don't learn how to socialize, they don't learn how to groom properly, they can't learn anything. So like this is an extreme example because they fed them really the worst of the worst stuff. But you think about that and you think about all of the, what are we supposed to call them now? Not neurotypical children, right?
yeah.
The children with autism and Asperger's and other sorts of learning disorders that are new, never been seen before,
Mm,
not well defined. That is a parallel. Like, how can that not be like a causative thing there that
right.
would affect us? And then there's others. There's other somewhat, more circumstantial evidence because, like I say, you can't do these sorts of randomized controlled trials in humans. But we do know that women who have preeclampsia or prediabetes or obesity, they are all subject to more oxidative stress, and their children are all at higher risk of pretty much every bad outcome. They will be small for gestational age. They will have increased rates of autism, increased rates of developmental disorders, increased rates of premature birth, increased rates of birth defects, and on it goes. It's an enormous, enormous problem, and it's preventable. And forget about like the past. Moving forward, we can stop it. This is an actionable, right? There's all kinds of horrible things that are going on in society right now. We've been lied to on so many levels. We've certainly been lied to about fat. We've been, people have come on the air after I've made some waves out there about vegetable oils, and people have come on the air to lie and correct, air quotes, scare quotes, the record. Right, Dariush Mozaffarian from Tufts came on to defend
Mm,
oils after I was on Bill Maher back in 2022. So they are lying to you.
mm,
And in order to protect your health and your family's health, you need to realize that we are living in a war zone. The war is on our health at the cellular level. And we need to have that mindset. But it is something that we can do. It's very simple. You just stop eating the seed oils and I teach you what to eat instead. There's plenty of alternatives. And yes, there's habits you have to change. And yes, you will feel like your life will have to revolve around food for a little while you're changing those habits. But once they become habits, then they're habits and it's not hard anymore. And everyone who does that tells me exactly that.